Opened in Durban after a patient was sexually assaulted at the Durban and Coastal Mental Health Care Center. The male patient was allegedly raped by another patient on Tuesday night. Today, a doctor's report actually confirmed the rape. The incident comes as the institution faces a barrage of allegations of abuse and ill treatment of their patients.
We are at the Sherwood branch of the Durban and Coastal Mental Health Institution, where the MEC for Health in the province, Dr. Sibongiseni Dlomo, is visiting the institution to also meet with management and staff of the institution. Now, you'll also recall that not so long ago, the SABC ran various stories about this institution. These shocking stories range from patients being used as security guards, allegations of rape, and also allegations of assault as well. You'll also recall that the day before yesterday, the SABC was also well informed that another case of sexual assault had taken place at the very same institution. Now, when the SABC posed a few questions to the MEC to ask him about why hasn't his department acted on this, in fact, it did tell the media that they knew about these allegations about 10 months ago. Of course, as the media, we wanted to find out why didn't they rather act on the allegations, because you also recall there's another act of abuse or sexual abuse rather took place the day before yesterday. And this is what the MEC had to say about that.
What brings me here again today is those continuous reports. I was not sure it's yesterday or the day before, but those continuous reports that we pick up, everybody now believes and understands that the Department of Health and Social Development are interested in getting to the deep end of this issue. So any issue that comes up again gets reported quickly. Hence, you see me visiting here, not necessarily going to be nullifying the investigation, but of course, rightfully so, because there has been another report that has come in, which is an adverse event type of a report, not a good report like to hear. So that is why, among other things, I'm here today. It's for it to be tabled to me was about a month, but the HODs, both HODs have been on it longer than myself, because I mean, before issues are raised with the MECs, they also in their own come to interrogate and listen to that. Like I'm saying, there's a structure called Mental Health Care Review Board. When they finish their investigations, and they really make sure that such reports go to the MEC of Health and also come to the MEC. Sorry, start to the HOD in the Department of Health, then the HOD will bring it to me. So I say, HOD, if you think there are certain misdemeanors that you are picking up, please attend to that, investigate with your colleague HOD, Social Development, and we'll be ready to hear the final report of the investigation that is taking place.
This was the Health MEC in the province, Dr. Sibongiseni Dlomo, of course, highlighting the various challenges that is currently facing the Durban and Coastal Mental Health Institution. Now, you'll also recall that in his interview, Dr. Sibongiseni Dlomo said that his department, as well as the Department of Social Development, were both working together to investigate the claims that have been labeled against the Durban and Coastal Mental Health Institution. Now, also just to point out, as we were busy with our interviews, one of the local police vans also pulled out in the area, because you also recall that the SABC reported yesterday that another case of sexual assault has taken place at the very same premises of the Durban and Coastal Mental Health Institution. And of course, we also remember that during the interview, Dr. Sibongiseni Dlomo said that he was going to meet with management and staff of the institution just to try to establish whether some of the reports that they've gotten so far are actually factual or not. Now, we'll also bring you more about the story as the week progresses. Over back to you in studio.